Canada's hospitals are running out of nurses, not just from burnout, not just from low pay, but because thousands are leaving for the US, and some say they're being replaced before they even have a chance to apply. Imagine training for years, serving through a pandemic, only to be told your job went to someone from overseas before you could even interview. This isn't just a staffing problem. It's a healthcare emergency that's pushing Canadian talent out the door and across the border. Section 1. Canada's nursing shortage. A national emergency. Canada's nursing shortage has shifted from a chronic staffing challenge to an outright healthcare crisis. Statistics Canada data show that registered nurse (RN) vacancies have risen by more than 219% since 2017, reaching 28,000 plus open positions by early 2023, the highest vacancy count among all professions in the country. By mid-2024, the figure surged past 42,000 vacancies, an increase of 147% over 5 years. The hardest-hit provinces are Ontario and Quebec. Ontario recorded 16,620 vacant nursing positions in 2024, while Quebec reported 11,150 vacancies, forcing hospitals to operate with dangerously low staffing levels. British Columbia also reports a severe shortage, with 5,325 nursing roles unfilled, and projections indicating the province will require 27,000 additional nurses by 2031 just to maintain current services. These vacancies exist despite an increase in the number of licensed nurses over the past decade. The RN to population ratio has barely improved, 66.8 nurses per 10,000 residents in 2024, down from 67.9 in 2020. The Canadian Institute for Health Information, CIHI, warns that while the absolute number of nurses is growing, demand is outpacing supply due to population growth, aging demographics, and higher patient care needs. A deeper cause is decades of cost-cutting. In the 1990s and early 2000s, health reforms reduced permanent nursing roles in favor of casual or part-time contracts. Hospitals downsized, early retirements were incentivized, and nursing education capacity was capped. These policies saved short-term costs, but created a generational talent gap that is now colliding with rising healthcare demand. Globally, Canada's nurse-to-population ratio lags behind countries with similar healthcare systems. For example, Australia maintains over 110 nurses per 10,000 residents, and Norway exceeds 180. Canada's lower ratio means nurses are working with heavier patient loads, increasing burnout and lowering care quality. Section 2. Burnout and overtime. The human toll. Burnout among Canadian nurses is at record highs. A 2022 Canadian Federation of Nurses Unions survey found 94% of nurses reported symptoms of burnout, and 83% said staffing shortages had reduced their ability to provide safe, quality care. Nearly half of respondents were considering leaving their jobs altogether. During the pandemic, these pressures hit critical levels. From 2019 to 2021, nursing job vacancies jumped 56.9%, with over 100,000 open positions in healthcare by early 2021. Hospitals scrambled to cover shifts, often resorting to mandatory overtime and calling back retired nurses. Overtime hours are staggering. In 2022, nurses logged millions of hours beyond their scheduled shifts. This is not new. Even in 2005, nurses worked 18 million overtime hours, equivalent to more than 10,000 full-time jobs. But unlike the mid-2000s, today's overtime often stretches into 16 to 20-hour shifts, especially in rural emergency departments. The consequences extend beyond fatigue. Chronic overwork increases the risk of medical errors, compromises patient safety, and fuels a cycle of attrition. As exhausted nurses quit, the remaining staff shoulder even heavier loads. This pattern is not unique to Canada. The UK's NHS and Australia's public hospitals have reported similar burnout-driven turnover spikes in recent years. A Royal Society of Canada review concluded that systemic issues, lack of autonomy, poor management support, stagnant wages, and a culture of do more with less have left Canada's nursing workforce vulnerable long before COVID-19 arrived. The pandemic merely exposed how close to collapse the system already was. Section 3. Why the US is so attractive. For Canadian nurses, the US offers more than just higher wages. It offers recognition and career growth. In Canada, the average RN earns CAD $72,740 annually at USD $54,000, while in the US, the median RN salary is USD $94,480, at CAD $128,000. That's a pay increase of more than 70% for doing similar work. The difference widens with bonuses and benefits. US hospitals regularly offer sign-on bonuses between USD $10,000, $20,000, relocation packages, and housing stipends. Travel nursing contracts can pay USD $3,000 or $5,000 per week, with some crisis assignments reaching USD $13,700 KD weekly, far beyond anything in Canadian public hospitals. The TN visa under the USMCA trade agreement gives Canadian nurses a streamlined work authorization pathway, valid for up to 3 years and renewable indefinitely. Credential recognition is faster through organizations like CGFNS, allowing nurses to move into US roles within months. The US also offers more flexibility. Canadian nurses often face rigid scheduling, mandatory overtime, and limited specialization opportunities. In contrast, US hospitals allow greater control over shift selection, specialty training, and lateral career moves into areas like nurse practitioner roles, research, or education. Australia and New Zealand have also targeted Canadian nurses, offering relocation assistance and pathways to permanent residency, highlighting that Canada's nurse migration problem is global, not just US-specific. Section 4. Migration Trends. Canada as a talent pipeline. Canada is increasingly acting as a talent pipeline for other nations' healthcare systems. In the early 2000s, health reforms and layoffs pushed many RNs south of the border. Today, the push factors are different but equally strong: wage caps, burnout, and perceived unfair hiring practices. Estimates suggest that thousands of Canadian nurses now work in the US, with more leaving each year. The Canadian Nurses Association projects a shortfall of 60,000 RNs by 2030, a gap that international recruitment alone cannot fill. Similar patterns have been observed elsewhere. The UK's NHS has struggled to retain domestic nurses, losing many to Australia and Canada in search of better pay and work-life balance. Canada is now on the losing end of the same equation, with the US, Australia, and even Middle Eastern healthcare systems actively recruiting its trained staff. Section 5. Perceived hiring bias and Indian nurse recruitment. One of the most contentious issues is the perception that certain hospitals and care homes are favoring internationally educated nurses, particularly those from India, over Canadian-trained applicants. International recruitment is part of Canada's official strategy to address shortages. Provinces like Ontario and Nova Scotia have introduced fast-track credentialing programs for nurses from select countries, including India, the Philippines, and Nigeria. In some facilities, this has led to a visible demographic shift in staff composition. While this recruitment fills urgent gaps, it has created resentment among some Canadian nurses who feel overlooked for promotions or even initial hiring. This sentiment is echoed in online forums, union discussions, and local media interviews. Data shows that around 69% of internationally educated nurses work in healthcare, compared to 87% of Canadian-trained nurses, suggesting that integration challenges persist even after hiring. Nonetheless, targeted recruitment from abroad, especially from India, is reshaping workplace dynamics in some regions. Without transparent hiring practices and communication, perceptions of bias can undermine workplace cohesion and fuel the migration trend. Section 6. Consequences for Canadian healthcare. The exodus of experienced nurses has tangible impacts on patient care. Emergency rooms in Ontario, Manitoba, and rural British Columbia have faced repeated closures due to lack of staff. Wait times for surgeries and diagnostic tests have lengthened, and patient-to-nurse ratios have worsened. Reliance on agency nurses is growing, and while they fill short-term needs, they cost significantly more per hour and may lack familiarity with hospital systems and patient populations. Training new permanent staff is expensive and takes time, often 12 to 18 months before a nurse reaches full efficiency in a new role. Other countries have learned these lessons the hard way. The UK's reliance on agency nurses ballooned NHS costs, while Australia's overuse of travel nurses led to budget blowouts in some state health systems. Canada risks repeating these mistakes. Section 7. What needs to change? Experts agree on several reforms. Increase pay to at least match inflation and compete with US offers. Reverse wage caps like Ontario's Bill 124, which limited public sector raises to 1% annually, worsening retention. Improve conditions by enforcing safe staffing ratios, reducing mandatory overtime, and offering more scheduling flexibility. Support domestic training by expanding nursing school seats and providing loan forgiveness for graduates who work in underserved areas. Balance recruitment by valuing both domestic and internationally educated nurses with transparent policies to avoid perceptions of favoritism. International examples show these strategies can work. Australia's nurse retention improved when pay scales were raised and staffing ratios legislated in Queensland. New Zealand's targeted rural nurse retention program cut turnover by 20% in 3 years. If you believe Canada should fight to keep its nurses, then this can't just be another story you scroll past. Share this video, talk to your friends, and demand answers from your elected leaders. Push for fair pay, safe staffing, and hiring practices that put skill before politics. Our healthcare system is only as strong as the people on the front lines. And right now, we're losing them. The clock is ticking. Let's fight to bring them back before it's too late.